For more than 2 years now, one story has quietly run underneath almost everything else happening in the British royal family. The king has cancer. Not a rumor. Not a tabloid theory built on a blurry photograph. An actual diagnosis announced by Buckingham Palace in February 2024 and never fully explained since. No one outside a small circle of doctors and family members knows exactly what type of cancer King Charles has. What the public does know is smaller, but it's real: a diagnosis, a treatment schedule that has stretched across 2 years, a few hospital stays, a video message about early diagnosis, and, more recently, a small but meaningful shift in tone from the palace itself. This is that story, told using only what has actually been said, by the people who were actually there to say it. The diagnosis came almost by accident. In January 2024, King Charles underwent a procedure for a benign enlarged prostate, a common condition, not considered serious on its own. But during that treatment, doctors noticed something else. Buckingham Palace's official statement explained that a separate issue of concern was found, and that follow-up tests confirmed it was a form of cancer. The palace announcement, released on February 5, 2024, struck an unusually direct tone for an institution known for careful, formal language. It confirmed the king had begun a schedule of regular treatments and had been advised by his doctors to postpone public-facing duties during that period, though he would continue handling state business and paperwork as usual. The statement added that Charles remained positive about his treatment and looked forward to returning to full public duty as soon as he could. The palace also explained why it chose to share the diagnosis publicly at all, rather than keep it private the way earlier generations of royals often did. The stated reason was to head off speculation and, in the palace's words, to help public understanding for the many people around the world also affected by cancer. According to reporting from People magazine, Charles told his sons, William and Harry, about the diagnosis himself, and personally informed his siblings, Princess Anne, Prince Andrew, and Prince Edward, before the news became public. That detail matters, because it tells you the family learned this news the way most families do, directly, from the person it was happening to, not through a press release. What the palace has never revealed, in over 2 years, is the type of cancer. Early tabloid reports guessed at prostate cancer specifically, but the palace denied that characterization. The enlarged prostate was a separate, benign issue that simply led doctors to look further and find something else. Beyond that, the specifics have remained private. And every credible outlet covering the story treats that gap the same way, as a deliberate choice by the king to disclose that he is a cancer patient while keeping the clinical details to himself and his medical team. That choice has actually been explained on the record, not just assumed by reporters filling in blanks. A palace spokesperson, quoted by outlets covering the family heading into 2026, said the guidance from cancer experts was that in his effort to support the wider cancer community, it was preferable for the king not to focus on his own specific condition, and instead speak more broadly to everyone affected by the disease. In other words, the silence around the exact diagnosis isn't presented as evasion, it's framed as a deliberate decision to keep the public conversation focused on cancer patients generally rather than on the details of one man's chart. The day after the announcement, Charles and Camilla were photographed leaving Clarence House, a small, ordinary image that nonetheless became one of the most closely studied photographs of that year, simply because people were looking for any visible sign of how he was doing. 2.5 weeks later, on February 21st, 2024, Charles held his first in-person audience with then Prime Minister Rishi Sunak since the diagnosis became public, a signal, however small. That state business was continuing even while public appearances were paused. He kept his word about returning to public duty. Charles stepped back from public-facing engagements for roughly 2 months, then resumed them in April 2024, beginning with an Easter Sunday church service that was widely covered specifically because it marked his re-entry into public view. There was a second, separate shock that same year. In March 2024, Catherine, Princess of Wales, announced her own cancer diagnosis, coming just about a month after her father-in-law's. She later revealed she had undergone 6 months of preventive chemotherapy through 2024 and announced in January 2025 that she was in remission. For a period in 2024 then, two of the most senior working royals were both undergoing cancer treatment at the same time, which is part of why that year is remembered inside royal reporting as an unusually difficult one for the family. Prince William himself put a name to how that year felt for him. According to reporting on his public comments, he described 2024 as the hardest year of his life, directly tying that assessment to the overlapping diagnoses affecting both his father and his wife within the space of a few weeks. It's a rare piece of first-person testimony from William about the toll of that period, not a private remark relayed by an anonymous source, but a description he gave publicly, on the record, of what it was like to watch two people closest to him go through cancer treatment at once. Charles kept working. Over the following year and a half, he carried on with a substantial calendar of official duties, including hosting President Trump during a state visit to the UK in September 2025. He also used his position to raise awareness about cancer more broadly, hosting a reception at Buckingham Palace where he spoke about his own diagnosis and treatment and thanked the researchers, doctors, and volunteers involved in cancer care. There were setbacks along the way, and the palace didn't try to hide them, even if it didn't dwell on them either. In March 2025, Charles was briefly hospitalized after experiencing temporary side effects from his ongoing cancer treatment. His office said he was admitted to the London clinic, the same hospital where he'd had his original prostate procedure, for a short period of observation. He was back in public the very next day, and palace sources described it, in fairly blunt terms, as a minor bump in the road rather than a sign of anything worsening. A planned hospital visit that same month to open the new Middleton Metropolitan University Hospital was postponed because of that reaction, and later rescheduled. By July 2025, Charles was speaking about the illness more candidly than he had before. During a visit to Middleton Metropolitan University Hospital, he spent time with cancer patients, including a man named Matthew Shinda, and talked with him about how he was feeling at one point, joking that bits don't work so well when you get past 70, a light touch on a subject that had mostly been handled with careful formality up to that point. Around the same period, a senior royal aide told the Telegraph that Charles was dealing with the illness incredibly well, describing his approach as simply managing it and living as normally as possible while following his doctor's guidance, and adding that medical advances had made a real difference in how the illness could be handled day to day. Public appearances that year also carried small, easy-to-miss signals about his physical condition. At Trooping the Colour in June 2025, Charles was present but did not appear on horseback, opting instead for the second year running for a carriage procession alongside Camilla, a routine adjustment that royal watchers read as a sign of an ongoing, gradual recovery rather than any single dramatic health event. The most significant update so far came in December 2025, and it arrived in an unusual format. A pre-recorded video message rather than a written palace statement or a live appearance. It was filmed at Clarence House and broadcast on British television ahead of a live fundraising special for Channel 4's Stand Up to Cancer campaign, hosted from a cancer clinic at Addenbrooke's Hospital in Cambridge. In the message, Charles spoke about the community of care he said he had come to appreciate throughout his own cancer journey, the specialists, nurses, researchers, and volunteers he described as working tirelessly on behalf of patients. He then shifted to the update people were waiting for. He said that thanks to early diagnosis, effective intervention, and following his doctor's advice, his own schedule of cancer treatment could be reduced going into the new year. And he called that milestone both a personal blessing and evidence of how far cancer care has advanced. He also used the moment to push a public health message, noting that at least 9 million people in the UK are not up to date with available cancer screenings, and describing that gap as 9 million missed chances at early diagnosis. Buckingham Palace followed the King's message with its own, more clinical version of events. A palace spokesperson said Charles had responded exceptionally well to treatment, and that his doctors advised his ongoing measures would now move into what the palace called a precautionary phase 1 that would be continuously monitored and reviewed in order to protect and prioritize his continued recovery. It's worth sitting with the exact wording here because it's the most reliable evidence available about where things actually stand. The king said his treatment schedule could be reduced. The palace said his condition would move into a precautionary phase and continue to be monitored. Neither Charles nor the palace used the word remission. Neither said cancer-free. What was confirmed was narrower and more specific, less frequent treatment, ongoing monitoring, and a tone from the king himself that one royal reporter described as the first genuinely unambiguous signal that he expects to have many years still ahead of him. Reporting through the first half of 2026 has been consistent with that framing. As of around May 2026, Buckingham Palace still had not disclosed the type of cancer Charles has, nor issued any new detailed medical update beyond the December 2025 message. The precautionary phase language has remained the operative description of his status. A royal biographer covering his reign at close range told IB Times UK in April 2026 that Charles was still undergoing cancer treatment while also describing him, in the biographer's own assessment, as happier in the role of monarch than at any point since taking the throne. Public duties have continued largely as expected. Royal Week in Scotland went ahead as planned in early July 2026, including the ceremony of the Keys, an investiture, and the opening of the Scottish Parliament. In August 2026, the royal family and the King's Trust marked the charity's 40th anniversary with a joint social media post celebrating its decades of work supporting young people, a routine but telling sign that the King's public-facing patronage work is continuing on schedule. Separate from the health story, but often discussed alongside it, is the simple fact that Prince William has been taking on a larger share of royal duties over the past 2 years, which is exactly what would be expected of an heir to the throne as the monarch ages and manages a chronic illness, and doesn't require any secret internal drama to explain. This is a gradual, publicly visible process, more engagements, more overseas representation, more of the institutional weight of the monarchy resting on the Prince and Princess of Wales as a working unit. Even outside observers have noted it. Speaking to the New York Post after meeting William in Paris in December 2024 during the reopening of Notre Dame Cathedral, President Trump said he'd asked William about his wife's health and his father's condition. William reportedly told him that Kate was doing well and that his father was fighting hard, adding in Trump's account that it was a sad situation because of how much William loves both of them. That's a real, on-record account of what one person says William told him, not an unnamed insider's paraphrase of a private family conversation. The clearest, most concrete examples of William stepping into a bigger role, though, come from his actual travel schedule rather than from anything said about him secondhand. In November 2025, Kensington Palace confirmed William would attend the COP30 World Leaders Summit in Belém, Brazil, explicitly on behalf of King Charles, taking the king's place at a major international gathering rather than simply attending alongside him. Before that, William spent several days in Rio de Janeiro for his own Earthshot Prize Awards, tying his environmental advocacy work directly to the trip. Days earlier, father and son had appeared together at a pre-COP30 climate event at London's Natural History Museum, a joint outing that royal reporters flagged as notable partly because the two men don't often appear at engagements together, and partly because it came shortly after William had spoken publicly about the kind of changes he hopes to bring to the monarchy once he is king. Then, in February 2026, William took his first solo overseas tour of the year, traveling to Saudi Arabia for 3 days on an official visit undertaken on behalf of the UK government, aimed at strengthening ties with the country. He met with Crown Prince Mohammed bin Salman and took part in engagements centered on Saudi economic reform, cultural initiatives, and environmental programs, echoing a 2018 meeting he'd attended years earlier alongside his father, then still Prince of Wales. Reports the same year also pointed to further travel ahead. The Times reported that senior royals were being lined up for possible visits to the United States in 2026 to mark 250 years of American independence. with King Charles's trip reportedly in advanced discussion, and William expected to attend the FIFA World Cup later in the year as patron of the Football Association, potentially with Prince George joining him. None of this required a secret crisis to explain. It's the ordinary, visible mechanics of an heir gradually absorbing more of a working monarchy's international calendar, documented in palace announcements and travel schedules rather than in anonymous accounts of private meetings. The family's day-to-day life has continued alongside all of this, in ways that are easy to overlook next to the health headlines, but that fill out the picture of where things actually stand. William and Catherine relocated with their 3 children, George, Charlotte, and Louis, to Forest Lodge, a larger property in Windsor Great Park, in the fall of 2025, a home reporters have noted is expected to remain their base even after William eventually becomes king. Prince George, who turned 13 in the summer of 2026, was also reported to be facing a decision about secondary school, choosing between his father's alma mater, Eton College, and his mother's, Marlborough College, the kind of ordinary family milestone that continued to play out regardless of what was happening with the king's treatment schedule. Now that Kate's own cancer is in remission, royal commentators have also pointed to the possibility of the Wales family taking on the kind of long-haul Commonwealth tour they haven't undertaken since 2022, when they visited Belize, Jamaica, and the Bahamas. Royal author Robert Jobson told Hello that a Commonwealth visit was overdue, citing a standing invitation from Australia's Prime Minister and speculation that a New Zealand leg could be added if the couple's schedule allows it. None of that has been confirmed as book travel. It remains speculation from a royal commentator rather than a palace announcement, but it reflects the broader sense among people who cover the family closely that, with both Charles's treatment scaled back and Kate in remission, 2026 was shaping up to be a year of returning to a more normal, more visible pace of royal life rather than one dominated by illness. Public opinion research gives a much clearer, better-sourced picture of how Britain views the King and Prince William than any anonymous insider account could. Ipsos has tracked this consistently, and the trend across 2025 and 2026 has been remarkably stable. William's approval has held meaningfully higher than his father's. But neither figure has collapsed, and support for the monarchy as an institution has softened more than support for either man individually. In an Ipsos poll conducted in April 2025, 7 in 10 Britons said they thought William would do a good job as king, while 56% said Charles was doing a good job in his current role, against 11% who said he was doing a bad job. That same survey tracked favorability across the wider family. William and Catherine again topped the list as the most popular working royals, well ahead of King Charles, Queen Camilla, and other senior family members. A February 2026 Ipsos survey found the same pattern, holding the Prince and Princess of Wales remained the most popular members of the royal family, though favorability ratings across the family had eased somewhat compared with the previous survey in November 2025. By June 2026, Ipsos reported that 60% of respondents said they were satisfied with how Charles was doing his job as monarch, compared with 71% who said the same of William. Both figures were broadly consistent with where they'd sat for the past several years, even as overall support for keeping the monarchy at all touched a 33-year low, driven largely by declining enthusiasm among 18 to 34-year-olds, among whom only 38% said they were satisfied with Charles's performance, compared with 76% among those 55 and older. This isn't a new or sudden gap. Ipsos data going back to well before the cancer diagnosis shows William consistently outperforming his father in these satisfaction surveys. 74% approval as a future king in a 2022 poll timed to the Platinum Jubilee, a jump to 73% satisfaction with his work as Prince of Wales following the 2023 coronation, and readings in the high 60s to low 70s through nearly every survey since. Charles's own numbers have moved in a narrower band too, generally sitting in the high 50s to low 60s for job satisfaction since he became king, and running consistently below the 79% average his mother, Queen Elizabeth II, maintained across 3 decades of the same tracking survey. Put simply, William has been more popular than his father in this specific measure for years. The gap isn't new. isn't a reaction to any single event and doesn't say anything on its own about the king's prognosis. It's a pattern that predates the diagnosis, held steady through it, and has continued, largely unchanged, since the December 2025 announcement. It's worth being just as clear about what isn't known as what is. The type and stage of King Charles's cancer have never been made public, and neither the king nor the palace has said the word incurable, terminal, or anything resembling it in any official statement or verified interview. No credible outlet has reported a private family meeting in which William and Catherine were told the king's condition was untreatable, and no such document, ultimatum, or crisis dinner has ever been confirmed by Buckingham Palace or corroborated by named sources. Stories describing detailed private conversations, exact words exchanged between family members behind closed doors, or emotional reactions witnessed only by unnamed insiders don't meet the same bar of evidence as